As more seniors and essential workers are finally getting their shots, they're turning to our Dr. Frank McGeorge with their questions.
He is back with the answers for another round of your vaccine concerns, starting with a question from a well-hydrated viewer. Doc?
Connie asks, is it okay to drink 4 or 5 glasses of water after getting your COVID-19 vaccine? Would it dilute or wash out the vaccine from your body? Connie, the answer is no. Drinking water has no effect on the vaccine. Now, here are some more of your questions.
Ellen asks, is it safe for senior couples to gather without masks after all participants have received the second shot and 2 weeks have passed? What about being around senior coworkers without masks who have all been vaccinated? The answer is yes, but it's all about risk tolerance, and you should understand the risks compared to the benefits of getting together with vaccinated friends. First, no vaccine is 100% effective. There will always be a chance that a vaccinated person could become infected. The good news is that even if you're infected, the chances of developing severe disease is much less. On top of that, if everyone is vaccinated, the chances of someone in the group spreading the virus is also lower. The biggest wild card is that we don't know precisely how long someone is protected after vaccination. In time, we'll have a better handle on the exact risk. For now, the safest thing is to continue wearing masks. But practically speaking, it's reasonably safe, and I wouldn't worry about maskless activities like eating if everyone is vaccinated. Now, another viewer asks, as an infant in Hungary, I was vaccinated against TB. Does that vaccine protect against COVID-19? I understand that currently there are studies examining that possibility. There have been studies of the BCG vaccination, which is given in other parts of the world against tuberculosis, having a protective effect against COVID-19. But at this point, the data isn't compelling enough to even remotely suggest that it would be a substitute for the COVID-specific vaccines that have been developed.
Now, finally, a viewer asks, when will the general public be able to get vaccinated? I'll give you an honest answer. We just don't know. The answer is going to depend on whether or not other vaccines like Johnson & Johnson's are authorized, whether Pfizer and Moderna can increase production, and how many people in the groups ahead of you choose to get vaccinated. I know that's not a satisfying answer, but any guess is really just a guess. Back to you.
All right, Doc, and that's why we appreciate your honesty every time we go through these questions. If you've got a question for Dr. Frank McGeorge, and there have been a ton of them, keep them coming. You can submit them on the homepage of clickondetroit.com.